He's so excited. You can hear below everybody saying, "We're so happy to see Dr. Miller." And funny story on how we met. We were at the Global Aesthetic meeting, and I just came and approached him. I said, "I love what you have in your product," and I'm sure he was like, "Who is this guy talking to me, not letting me, not leaving me alone?" And he had important meetings going on. I was like, "Trust me, I really think that I want to add what you're doing to my practice." And I teach a lot for from a training standpoint for different innovative ways to rejuvenate the face and the neck. Being an oculoplastics doctor, you don't have a lot of oculoplastics doctors come up to you and say, "Hey, I really have a really big interest in this area." So I'm sure that was sort of a shock for you.
Yeah, it was amazing to meet you, and the whole Ellevate procedure, the evolution has been really over a decade, and I figured it out about 2 years ago, perfected it, and got the procedure to the point where it's very easy to perform and very easy to teach other surgeons how to perform the procedure, and it really addresses an area that's unmet with any other technology. So as you know, Sean, we both have technologies that tighten the skin. Yep. And I'm so excited about Face Tight. I love that technology. I use it to tighten the skin envelope. But where Ellevate fits in is lifting the muscles and glands that sit underneath the skin. So it kind of gives surgeons that complete solution.
And there's a lot of people that are tuning in that are not surgeons. Kind of talk about why this came about, why this was something you were passionate about, and how it's changed your practice.
Sure. So I've been in practice for 22 years, and when I went into practice 20 years ago, or after I'd been in practice a couple of years, I was dissatisfied with open neck procedures. I felt like they were very invasive. Mm-hmm. The patients had very prolonged healing times and more complications. When you surgically open the neck, you're sort of opening Pandora's box. So back then I started thinking, there's got to be a way to sew the muscles underneath the skin without having to lift up all the skin. So that's when I came up with the whole concept of a lighted needle with a thread attached to it. And we pass that needle and thread underneath the skin, and you can see the light through the skin. So we're able to still sew the muscles and support them.
Yeah.
We're not opening it. So it's a great solution for patients because it's less invasive. It sharpens and refines the neck, but without incisions.
Yeah, and what do you like about the timing of your product coming to the market? I know that the trend in my space, as well as I believe in your space, although I know people have come to you for facelifts for years, has really gone to minimally invasive, and that's kind of I don't want to overuse that term because I feel like there's some stuff that's non-invasive, which is on the skin, minimally invasive needling, and then sort of like a semi-surgical, which kind of includes the face type treatment and the Accu-Type treatment, and I think and as well as liposuction. But where do you feel like my Ellevate falls in that paradigm?
Sure. So I think it falls in there in many ways. I think two things have happened over the last couple of decades. The first one is that the consumer today, the plastic surgery patient and client, they're looking for less invasive ways, but yet they have to be effective. I mean, these things have to work.
Yeah.
So they're looking for solutions that are, not the traditional big invasive surgery with incisions everywhere and long downtimes. They're looking for things that work quickly, but they have to be effective and safe. The other thing that's happened is energy-based technologies such as Smart Lipo, which was a laser technology that I used for about 8 years. There's Face Tight that I've had for the last 2.5 years. That's radio frequency that tightens the skin. So now you have this paradigm shift where we have energy-based technologies that tighten the skin rather well. Some of them approach the tightening of a facelift. So if you have a patient who's a little bit younger and they want to sort of ward off the aging process a little bit sooner, then you can use energy and combine that with Ellevate. Ellevate is really, it's the shaper and supporter of the foundation of the neck. It lifts and supports the muscles so that when you have that canvas or the skin that sits over those muscles, it's smooth and refined.
And I've seen, a couple of higher profile TV shows that you've been on, including The Doctors, Entertainment Tonight. Why do you think there's such an interest right now in California specifically, but also in the industry when it comes to this technology?
Well, I think that, the market and so on is very much geared towards less invasive. So I think that's a big driving force.
Yeah.
And then also I think with the selfie culture, I mean, here we are. We're able to have this wonderful dialogue, you and me.
Yep.
That, 10 years ago, we couldn't do this. And so with social media, people are taking all these pictures of themselves. They're seeing the way they look. People are very conscious about, having a neck roll when they look down and check their phones. So that's sort of been a driving force. And then just the whole thing in California, California is the entertainment industry. That's our backbone.
Yeah.
So those folks, it's very entertainment oriented and appearance oriented. So all those factors come into play.
Fantastic. I know we talked about before and after pictures and technique. Do you have anything that you can share with us to kind of maybe show some of the, we have a lot of surgeons that have messaged me, and I have a bunch of questions for you to ask as well, but if you have some of those, you have something you could show us?
Sure, absolutely, yes. So let me see how this looks here. This is my homemade COVID-19 audio
I love it.
program. But let me see here if you.
Well, actually, if you can just push the button, because it's reversed here. So if you can push the flip button on the top left of your camera, you can actually flip it right in front of you, and you can see it, so it's not reversed. There you go. And now just turn it back around.
Oh, wait a minute. Okay. Oh, turn my phone around?
Yeah, turn your phone back toward you.
Oh, got it.
Perfect. Now we can see it. Awesome. And if you can zoom in, just using both fingers slightly, you can zoom in a little bit closer, and that's a perfect view. So why don't you walk us through the procedure? Because and I'm very fortunate. Greg's asked me to train as well, being one of the few oculoplasties in the country who've really taken this on. And if you can angle your camera down just slightly, just so it's not catching that wall ahead of you. Actually, just the other way.
Okay.
Perfect, right there. So walk us through the procedure and kind of talk about also who's a good candidate for this.
Okay, great. So let me just go back here. So this procedure is performed, like I was saying, with light guidance. So the procedure itself is placed just like you can see in this illustration.
If you can tap on your phone just once, just gently, and maybe focus, it's a little bit of reflection there.
Let's see here.
There you go. That's better. Perfect.
Is that better there? Okay. Let me lower this just a little bit. So the procedure...
Actually, if you can push the computer screen front and back just to get a little better glare so people can see it. Maybe pull it back towards you.
Okay.
And actually just kind of bend the screen down a little bit. That's much better right there. Perfect.
Right there?
Yep.
Okay, great. All right. So anyway, so the procedure is just placed, just like you can see here where I'm drawing underneath the neck, and you can see the animation on the right side of the screen. So it's just a suture loop that goes underneath the chin area. And this is how we place it, and it just supports that area underneath the jawline. You can see here on the side view where we place it as well. The procedure consists also of using the same device to make little cuts in the muscle band. I don't know if we want to show the viewers this. This is a little bit of surgery, but it might be.
I think it's worthwhile to show, and I think it's important people know what they're getting involved in.
Sure. So this is a 1-minute video.
This is a little bit graphic. If you don't want to tune in, I understand. This will be posted on our YouTube later as well.
Yeah. So what I'm doing is I'm just passing this rod underneath the muscle, and we're just going through the skin out on the side. And then we're just going to reverse the rod. We'll just kind of pull it out, and then we're going to reverse it and go over the top of the muscle. And what this does, it passes a suture, like a thread, around the edge of the muscle. And then we're going to use that little thread to make a little cut in the muscle. Now, if you are familiar with a normal procedure that a surgeon would do, this would require a surgical opening of the neck. And we're doing all of this through little needle punctures. So I'm just going to grab both ends of that thread.
I'm getting some questions. If you guys want to send us questions as well, feel free to send me those. I can ask Dr. Mueller.
Yeah, so there you can see we're just making a little cut in the muscle. There's no incisions at all. All this is taking place through a little 1-millimeter puncture, which is pretty cool. So we made the cut along the muscle band there. And then the next part of the procedure is where we place the suture, and this is that lighted needle and thread that I was telling you about. And this is the crux of the whole procedure, and this is how it works. So that light that you're seeing coming through the skin, your surgeon will be watching that light. Therefore, they know exactly how deep they're passing the rod and in what direction. And we're just placing this little matrix underneath the skin, just going from dot to dot to dot, creating sort of a sling that goes underneath the jawline. And you can see that we just pass it easily from each little puncture, one to the other, and none of these punctures require stitches. They all just seal up in just a matter of days.
And these patients are fully numbed up, and some of them are asleep, some of them are not asleep, but they don't feel this at all, which is amazing.
Yeah, not at all. And we do the majority of these under local anesthesia. I'm going to show you that in a minute with the patients totally awake. So it's really nice, and it's an easy procedure to perform. Now, here's the actual procedure itself. So now this is a real live patient. This patient is totally awake. We just gave him a Valium and a Vicodin, and he's just awake and talking to us and so on. We're just passing that light underneath the skin. You can see we just go from each little puncture from one to the other, and that's how we build the support system underneath the skin. And this support system sits right over the patient's muscle. So when we tie it, it's literally like a party hat string, if you can imagine it coming underneath your jawline. We tie it, and it just lifts up the muscle underneath, smooths it out, and the skin gets lifted with it as well. We combine this with energy-based skin tightening like InMode's Face Tight, and that tightens that whole skin envelope. So the two together are just such great synergy and give such excellent results.
And I think Dr. Mueller made a great point. The reason that we're heading this way from a surgical or semi-surgical or minimally invasive standpoint is we do not want to make that larger facelift or neck lift incision like we've had before. Now, some patients that have a lot of excess skin, they still need some of that skin removed. But if you don't have a ton of excess skin, but you still want that tightening. So, I mean, I've had patients as young as 25, 30 come in for consultations. Dr. Mueller, you agree? I mean, the younger patients that still have that fullness, whether they're in great shape or they just have the excess skin, they want this tightening here.
Oh, absolutely. If someone is born with a genetic sort of ski slope neck, Ellevate is a great option for someone like that. You know, you could do a little bit of lipo if they had a little bit of fat underneath the skin, and then place Ellevate, and it will really give them the jawline they never had. So it's not just for older people. This is for anyone who wants a more sculpted jawline. And those are all the ones I have.
Awesome.
Yeah, I can get those to you, and you know, so we can take a look at those. You know,
yeah, that does happen sometimes. It gets a little bit grainy for whatever reason. We had a question here about how long the procedure takes and what the downtime is.
Yeah, so the procedure to perform takes about an hour to an hour and a half to perform. That includes injecting the area with numbing medicine, waiting for that medicine to take effect, and then performing the, you know, possibly face tight, radiofrequency skin tightening, or lipo. So about an hour and a half. As far as downtime, our patients usually take 3 to 4 days off, and then they can go back out to their regular activities. With men, we have them grow a little bit of scruff because they're going to have some bruising. With women, you know, we'd have them wear a scarf or something if they needed to go back to work in 3 or 4 days.
Sure.
And then as far as healing, when are people camera ready? We usually tell our patients 10 to 14 days is when they're going to be ready to, you know, go out and about. But for total healing, we're looking at 6 weeks for 90%, and then 6 months for 95%, and a year for 100%. And I say that because the radio frequency that I frequently use, that's a several month process to sort of shrink wrap the skin.
Yeah, I think the big question I get all the time is, you know, if I get a percentage improvement with the face tight or the Morpheus treatments or the radio frequency alone, and then I get a certain percent improvement with a facelift, which would be traditional surgery, where do you equate the Ellevate plus or minus some of these other adjuncts?
Yeah, so I mean, when I see patients when they come in, I determine do they need to have skin removed, and that's usually in a patient who's 50 plus years old, and so if they have a lot of redundant skin, then I go ahead and I tell the patient we're going to need to do a little skin tuck and remove some skin in and around the ears. But I still always use Ellevate. I don't open the necks on any of my patients, even if I'm removing skin. If it's a younger patient, say in their 20s or 30s, and if they don't need energy-based skin tightening, then I would just do Ellevate alone. If I see the muscle bands, I have the patient sort of flex their neck muscles and we look for those cords.
Yep.
So if you have the banding, that's when you need Ellevate.
Great. We have another question about how many treatments or how many procedures they need to have to get their optimal results. And is it just a one and done deal, or do you see people needing repeat treatments?
Yeah, that's a great question. So, a lot of people get this confused with the thread lift and they think, oh, I'm going to have this done, every year or, every, month, or not every month, but every several months. The great thing about Ellevate, the suture material is a permanent suture material. So we have patients who are out there 5, 6, 7 years and still have results. So it's, as you were saying, it's a one and done. It's a one-time procedure. You do it all in the office. And you're done, and you see the results instantly, and they just get better and better over time.
And I've seen, for us, we get this question all the time as surgeons on how long anything lasts, and I like to tell patients, we can turn back the clock. If you want to quantify it, sure, you could say 5 to 10 years, but the face continues to age, and so you have to do some maintenance treatment as well, whether it's good skin care or your cosmetic injectables or skin tightening or other things. But I think the big thing I've seen in my practice that's changed by adding this to the radiofrequency treatments is the sharp jawline. I mean, there's no doubt that this has taken, a very good result to an even better result, and my patients love it. And again, I don't think there's any added downtime to doing the traditional procedure that we do, which is the face dive procedure.
Yeah, and that's what I love about it. I mean, when patients come in, they're always, what they do is they'll come in and they'll actually take their fingers and push up on the skin here up by the ears. And so when they do that, I just think in my mind, that's an Ellevate case. That's the case where I can add Ellevate and give them that snatched jawline. People love that. People want to have the shadowing here. And like you were saying, it doesn't add any more recovery time. It's just another added adjunct that a surgeon can do that will set them apart from other surgeons.
And you've posted about this on your Instagram as well, and just told me you have not had to go back in and open a neck in years, and you've been able to do this neck tightening procedure as your primary treatment. Even if you have a true facelift procedure, you're still using the Ellevate.
Oh, absolutely. I do not open necks. It's been over a decade since I've opened a neck. And I do a lot of facelifts. So I do a lot of surgeries where I'm removing skin, but it's so nice because I don't open the front of the neck. So the recovery time is shorter, complications are less, and the contours are smoother.
We had one other question about science and safety. Has there been research been done on this treatment? What are the safety concerns that you can have with it? And those are kind of the general questions we're getting.
Sure. That's a great question. So this type of procedure, when I designed this procedure, I designed it using the template of another procedure called the GM Papa neck defining suture. So that was sort of the anatomical and sort of the design of the system. So suture suspension, which that's what this is, has been done for years in procedures. And it's normally used when doctors open up all the skin, then they just place some suture strands from one ear to the other. Ours uses the lighted needle and thread, so we're not having to lift up all the skin because we can pass it and we can place it accurately. So there have been thousands of those operations performed. I'll say this, I'm very excited because our company, we're doing an FDA study, and so we're going to be showing the FDA that these suture strands can be placed safely and effectively, which we're very excited about that because we want to get the neck lift indication. So we
and I know you can't say neck lift and facelift. I can. I'll tell you this. This is basically replacing a lot of the traditional neck and face lifting on your early aging patients. Even some of the patients, and Dr. Mueller, I've been very lucky. I mean, I've trained with their team. He's come down to my office personally. You can really treat patients. It should be. I think initially we were thinking mild to moderate laxity and mild to moderate bands, but I'm even getting improvement in severe patients who have severe neck laxity. And patients really appreciate the fact that they can get this underneath in the office. You know, we offer it in Austin. You know, there's quite a few doctors that offer it across the country, even internationally. And I think it's just really, you know, it tells you the trends of how things are going and you know, kind of the needs of the patient, and we're listening to them and understanding, you know, if there's safe ways to do things that are minimally invasive without opening up a neck, that can be done under local anesthesia and reduces your downtime, reduces your scarring. I mean, those are all music to their ears. You don't have to go into details here, but one other question is how long have you seen your results last? What's the longest you've seen it last? I guess you can tell us when you did your first case and how long that, if it's lasts forever, if you had to go back in. And then what do you tell the patients on how long it'll last?
Sure. So I did my first suture suspension using the rod that we're passing under the skin back in 2008, in October of 2008. So we've got, you know, 12 years of.
I'm sure that was a lovely soul that you were like, listen, I have this great idea. I'm going to do a facelift, but we're not going to cut. And they were like, I must really trust you, Greg.
It was actually my office manager at the time.
It's always the office manager.
There's a lot of trust there. But I've been working on it for years, and it slowly evolved to the point where we could do it all through little needle punctures. So it wasn't like one day I just thought of it and tried it. So the procedure has evolved. So I have 12 years of experience, about 1,800 cases. And I'm a small, you know, solo practice here in Beverly Hills. And I have people who still come in and see me for Botox and so on. And whenever we get images, we have our patients look down. There are patients who've been out 8, 9, 10 years who still have the support. So it's a long-term sort of thing. But like you were saying earlier, Sean, we're going to age, you know, and what we do as plastic surgeons is we reset that aging clock, and then people start aging from then. But I think that with Ellevate, because you have that support in there, we're sort of slowing that process. And that's what I love about it, and that's what our patients love about it.
Two other questions. One about pricing. Secondly, should you do these things earlier in your 30s and 40s because it still looks natural? Like, what are your thoughts first on the price? I know obviously price ranges from reason to reason. You don't have to go into details too much, but maybe give people a general idea of what the budget costs on that versus doing a traditional facelift.
Sure. So I'll touch on pricing first. So I'm in Beverly Hills and have been in practice about 22 years. And so our prices are probably a little bit different than the middle of the United States. But from talking to surgeons, and we have several throughout the country, which is great, so hopefully people look them up, the prices range anywhere from $6,000 to $15,000. I would say in Beverly Hills, it runs probably about $12,000 when I do these Ellevate cases. And then if we combine them with FaceTite, then we're looking at about $15,000. If it's a facelift, then we're looking at $25,000 to $30,000. And those are more involved because there are incisions around the ears.
And you get to have Dr. Mueller do it, who invented the treatment. I mean, there's a premium for that, I would say.
Well, I love what I do, and I will tell you, if it didn't work really well and it didn't last a long time, because I'm in solo practice, I'd be doing a lot of revisions, and those are few and far between, which I love, and very few complications, which I love.
And I think the next question's about, and also we do offer it in Texas. Our prices are just slightly lower than they are in Beverly Hills, but again, like, you know, we do a lot of these cases. We really feel like I believe in it because I've seen a lot of other things that don't work as well. And I think the combination treatment between giving the skin tightening, the skin envelope, that added boost to this procedure is a great combination. And the next question was about, do we agree that mid-30s and 40 plus is a good time to start doing this, and so it continues to it looks more natural at that age?
Yeah, I think for sure. I think especially nowadays, the way the plastic surgery market is, and people want to stay looking the way they feel. So people should start a little bit earlier if they start noticing some aging in the neck. And I would say there is no age that I would say it's appropriate to do it. It's really when someone looks in the mirror and they say to themselves, my neck is starting to fall, or this is the neck I got from my parents, and it's sort of sagging and I'm unhappy with it, or if you see the bands. So it's a personal thing, but definitely when you start seeing things come down, it's better to do it sooner than later.
And then we have time for a couple more questions. One other question is how do you find someone who's offering this near their hometown? And then secondly, how much time should you plan off from physical activity after you get the treatment?
Yeah, so as far as how much time off work that you should think about or working out, we tell our patients you can resume, rigorous physical activity in 3 weeks, but certainly things like jogging or lighter activities people can start doing in 2 weeks. So 2 to 3 weeks is when you got to kind of take it easy. But remember, there are no incisions, so that's the nice thing. So you don't have to worry about wound healing and things like that. And then regarding how do you find a surgeon, it's so exciting because just like Dr. Paul, we've been training surgeons. Dr. Paul is one of the trainers for the Southern United States. So we have surgeons throughout the United States who are learning. So if you go to the website, and the website is www.myellevate.com. And Ellevate spelled with 2 L's. So it's MYELLEVATE.com. Go to that site. The doctors are listed on there. You just click on them and you'll get routed right to their offices.
Now we're starting to get more questions pile in here. Another question is about, have you seen reaction to a suture because it's a permanent suture or infection?
That's a great question. So with every surgical operation, and talking about just clean operations that are done in our offices, there's a little less than 5% infection rate. So we treat all of our patients with antibiotics, and we're very careful with sterile technique. Having said that, we've had about a 1 to 2% infection rate, and that's because it's a permanent suture, and if it gets infected, we treat patients with antibiotics. We've never had any long-term scarring or anything like that from an infection. So just like any other operation, if there was an infection or what some people call a reaction to the suture, then you'd treat with antibiotics. This suture is very safe. It's the same suture material that heart surgeons have used for 100 years to sew in heart valves. So it's very safe to place it in the body.
Next question was, if you have to repeat the treatment, I know that I asked you this when I first learned about everything, was can you go back in and do it? Is it harder to do it the second time that you do a follow-up Ellevate procedure?
Sure. So during the learning curve of learning how to do Ellevate and other suture suspensions, in the beginning, I wasn't sure how tight to tie it. So I did about a 15% revision rate early on till I learned how tight to tie the suture. So a lot of those patients said, oh, just go in and put in another one. So I have a lot of experience of doing that early on. This was about 10 years ago. So it's very easy to go in and put a new one in. In fact, if a surgeon is learning and let's say they don't tie it tight enough and the patient doesn't have that significant results, you wait 6 months, you go in and just put a new one in. So it's really easy. You don't have to go in and pull the old one out. You can just put a new one in right over it.
And during that case, do you go in, put full tumescent anesthesia? Do you dissect the tissue again, or do you just kind of thread it through?
I would do the same thing I did the first time. Tumescent the area with a minimum of 250 cc's of fluid, tunnel the area with a liposuction cannula, and then place the Ellevate suture suspension. Same technique.
Fantastic. I'm getting more and more questions. Sorry, we're here. We may as
That's
well
all right.
answer
I
that.
know where else to go. So.
I know. Another question is about, this is a non-Ellevate question, if you're okay. I think we'll ask you something on Ellevate. How do you address the mid-face for your patients who have who have laxity here as opposed to down in the neck?
Yeah, so for those patients, certainly if it's a younger patient who has just a little bit of early sagging of the skin, a little bit of laxity, something like radiofrequency with microneedling would be very appropriate to just tighten and tone that skin contour. Fillers work very well to sort of fill the areas early on. And certainly in my older patients, then I would do a facelift and I would do a SMAS, which is the deeper layer of the muscles, do a little bit of tightening of those along the cheekbones. But for younger patients who aren't candidates for surgery yet, fillers work very well to sort of lift the cheeks up, and they actually do almost like a little mid-face lift, which is very nice.
Next question was about versus threads. Someone asked, like, this seems like it's like a thread, and I've gotten a thread brow lift in the past. Can you do a My Ellevate brow lift? I don't think I've asked you that question. I think it's a good question to ask, though.
Yeah, it's a great question. So let's talk about threads versus Ellevate. So threads are usually barbed sutures that are placed just in the deeper layer of the skin. And those barbs, they just kind of lift up the skin envelope. And, you know, they're used in brow lifts like this person is asking, and they dissolve over time. And so the scar tissue that forms after they dissolve kind of holds things, you know, in place. For the neck area, this is a permanent suture. It's not placed in the deeper layer of the skin. It's actually placed beneath the skin, right on the muscle. So that keeps that permanent suture away from the surface. It also keeps it deep enough where you're not going to have dimpling or anything like that, or tethering of the skin. So it makes it a really nice way to lift things up. So it's a permanent suture. So it's different than threads, for sure. I have used it on the brow before. What I do is I combine it with an endoscopic brow lift. So I'll use the endoscope to free up the periosteum under each brow. And then I'll just put a suture loop if I'm lifting the tail of the brow. And then a middle brow, I'll place another suture loop, and I just put them subcutaneously. I've used absorbable and permanent suture for those. Either one works very well.
So talk me through that brow area again. I have so many patients that come in to get Botox for a brow lift, or they get toxins. They'll do filler even to augment the brow before they come to me for a surgical brow lift. I know in the past endotines, and some patients still use, and some doctors still use endotines as well to kind of, and people don't know what endotine, and basically you're putting a little, you know, you're drilling a little bit into the bone there and putting an implant to basically secure the skin higher. If you're putting in a permanent suture, where are you attaching that to superiorly?
Yeah, so with an endoscopic brow lift, I'll make the 5 traditional incisions, you know, in the hairline. And those incisions are each about a 1/2 inch to a little bit longer in length. I'll dissect down, lift up the periosteum, and then my suture loop will actually go in one of those, but it'll stay in the subcutaneous plane and just down to the substance of the brow, out through a little puncture, and then just straight back up. And then I just tie it up there where that incision is. So it's actually just kind of quartering the soft tissue up there. And then I just staple the incisions up in the hair-bearing area of the scalp. I don't do a lot of those because most people want Botox for brow lifts. But it works very well, and I'd be happy to show you that next time I'm in Austin. We should do
I think between the, I mean, I had, and Sabrina Fabi just joined us too as well. I had an amazing conversation with her last week about neck and jawline, and you know, she uses a lot of combination treatments on you know, chin augmentation, filler, as well as ultrasound as well, or you know, basically skin heating of the tissue there. What is your thought on the chin and chin augmentation as an adjunct to the Ellevate procedure? Do you think that's something that you address in the and then it all comes down, I guess, to the preoperative discussion with your patient. But if you have a patient who has a recessed chin or kind of a smaller chin in kind of general terms, how do you address that with the Ellevate to give the patients the best results?
Yeah, so what I do is, we'll drink water here. So if a patient comes in and they have a small chin.
I'm not drinking water here.
They have a small chin.
My kids are asleep. I'm enjoying it.
I love it. Yeah, love it. Cocktail hour. Anyhow, if someone needs a chin implant, then absolutely we'll talk about that. And oftentimes people will come in and they have a less prominent chin because they have that ski slope neck. So I'll tell them, I'll say, you know, there's 2 options here. One is we can go ahead and just do Ellevate, and let's see if that changes the relationships of your chin projection to the vertical component of your neck, because that may make you very happy, because it's going to make your chin look stronger. If you remember those pictures I showed you, their chins all look stronger. Or we could go ahead and do a chin implant, you know, in conjunction with your Ellevate procedure. So the sequencing of the procedures, I will always do the chin implant first. So I'll make a little submental incision here, go in, place my chin implant, and then I'll do all my tumescing of the neck. I don't do it in the other order because I want to see the relationships of the soft tissue, and I just inject a minimal amount of 1% lidocaine with epi.
You should definitely connect with the doctor that I spoke with earlier today. He's an oral maxillofacial surgeon. He's a fellowship director in facial plastic surgery, and he was talking about basically creating, you know, very customized jawline and chin implants, and he was really interested in adding the Ellevate procedure to kind of even add to his FaceTite results. He's using FaceTite quite a bit. And I think, like, in my practice, and I think, I don't know if you're seeing this or if I'm seeing this, or maybe you were just kind of a visionary and knew this was going to happen with the selfie generation, but, you know, I think for me, the first thing I went into was thinking about, you know, tired looking eyes and folds. But then as I've gotten through practice, stayed in practice longer, I think a lot of people really are not addressing the chin issue as well as like this. And what I like about the Ellevate is it goes right underneath the jawline to give the added snatch. And we've seen that with patients who've just gotten, let's say they've only gotten radiofrequency, they've only gotten liposuction, and you're really not able to do that additional tightening. So I think it's a very, very smart area to focus on, and quite a revolutionary treatment, because I think patients were mainly sent for surgical evaluation, like a pure facelift only as their option.
Sure.
Last question.
Yes.
Hey, go ahead. No, go ahead.
I was just going to say, just to also cap it up, combination technologies, I think, are the hottest thing that we have going today. And it used to be everybody would come in and they looked a little bit old, they'd get a facelift. Well, the beautiful thing is, we have so many things in our armamentarium now where we can do so many different things. And just like you were saying, addressing the tear trough, addressing the nasolabials, and the chin area, that's something that probably gets discarded because people don't really see their profile that often. But I think all these areas are so important when we're seeing patients to evaluate and address.
One last medical question, then we have
Yes.
5 fun questions for you to wrap up and let everybody know a little bit more about your personal side. But
Sure.
the last question is if you've been getting fillers in your jawline and toxin in your neck for years, how are you an okay candidate? Are you going to have excessive swelling, or do you need to use those after this treatment? That's a good question.
Yeah, it's a very good question. I would say this, for filler that people have along the jawline, mid-face, and so on, you go ahead, you can do Ellevate, because Ellevate's going to address the area underneath the jawline, and it's just going to sharpen the angle of the jaw. You don't need to dissolve them or wait for them to wear off. I did treat a patient actually from Austin. I did an Ellevate on this young lady, and she had a lot of filler in her chin because she was very unhappy with her small chin. So we dissolved that, and then 2 days later, we went ahead and put in a permanent chin implant as well as Ellevate. So I think each case is, specific to its own needs. But certainly, if you have a lot of filler in the front of the chin and you're thinking about a chin implant, I would dissolve it first. That'd be the only time.
All right. Ready for your rapid questions to wrap it up?
I'm ready.
All right. Number 1, what's your favorite food?
Favorite food, lasagna. Of course, I've eaten a lot of it because I made some and we're eating it every day, so now I may not love it anymore.
Number 2, what accomplishment are you most proud of?
Probably Ellevate, designing a medical device, getting it through the FDA, and managing the manufacturing process and doing a startup company all in one.
Are you a beach guy, or do you like to go skiing when you're relaxing?
I love the beach. We have a place in Long Beach, and I love it. We go down there on weekends very often. I love the ocean.
What are your interests outside of medicine and surgery?
I love to travel. I love snow skiing. I love to go up to the mountains. And just being outside, hiking, doing stuff. I love Southern California. I'm out in the desert now, so we've been hiking every morning, so I love that.
All right, final question, no pressure. Do you wear pants during these interviews? I'm not going to tell my answer on that one. I'm also not going to say what's in my cup. But anyway, this is a good question. I'm actually going to do, I'll give a quick little plug. So Sheena Bay and I tomorrow evening will be doing a meditation at 8 p.m. Central, really trying to send some positive energy, positive vibes to our healthcare workers. I really would appreciate everyone sharing that, joining in with us, and really just kind of, take some personal, private time for reflection. And I think it's going to be really interesting. But the question that we had was, how do you think aesthetic medicine, aesthetic surgery will change after COVID-19? I think it's a good question. We haven't really talked about that, what it looks like ahead.
This is what I think. I think that after COVID-19, I think there's going to be such a pent-up demand for things to help us look good and feel good. And I mean that in the fitness industry. I also mean in the hair industry, you know, coloring and cutting hair and so on is going to be very big. I think that people are definitely right now very aware of their bodies. We really have nothing else to do than, you know, focus on taking good care of our bodies. So I think it's going to be actually a very positive thing for what we do. People want to be their best selves and look really good.
I love that answer. And I feel the same. I mean, we both have been connecting with new patients, old patients through virtual consultations and follow-ups. I think this kind of pushed us all forward toward the virtual relationships we have with our patients, which is a way to connect with surgeons or specialists across the country. And I think it's just going to catapult us into the next phase of the way aesthetic physicians practice. And so, Dr. Mueller, I don't want to take too much more of your time. Thank you so much for great information. I'll have Dr. Mueller send me over some of those photos. I probably have a lot of those photos as well, but I'll have him send them over to me and I'll attach them to this video and I'll post them as well on my Instagram. So have a great evening. Stay safe and stay healthy.
Great. Thank you. Thanks, John.
All right. Have a good one. Good night.